Banko and Sabronum are two farming communities in the Ahafo-Ano Southeast and the Setre East districts, respectively. Assessing healthcare in these areas comes with its own challenges. The Banko Health Center serves as a referral point for CHIPS compounds within 5 adjoining communities in the Setre East district. Health workers here face a challenge of procuring medical essentials as they have to travel to Efijase or sometimes to Kumasi to get some of these supplies. Justice Akwabwachi is a senior staff nurse at the Banko Health Center, and he speaks about the challenges in getting essential drugs for the facility.
Gone were the days where you could make a requisition today and medical stores will bring the item to you, let's say in a month. So we were having shortages a lot, because we are supposed to stock our stores for a maximum of 3 months. The drugs we use, can only stock the quantity we will use for only 3 months. So let's say a month for the drugs to finish, they make a requisition to the medical stores. And that one you cannot tell. You don't decide when the drug will come in. They prepare everything and bring it to you.
The health center is one of the facilities that receives supply from the medical drone center. Health workers here say the drone technology is impacting positively on their operations. During our visit to Sabronum in the Ahafo-Ano Southeast district, 2 requests were pending and health workers wait anxiously for the arrival of the drugs. Soon, the drone arrives.
This is for an emergency cases. Every delivery case is an emergency case. So if somebody comes and you don't have it, and you have to, pick a car from here, even if you have to go by your own car or a facility vehicle if it's available, it means it will take you not less than 3 hours before you can go to Kumasi, purchase the needed drug, and then maybe come back. But with Zipline, when you do the request, maximum is 45 minutes and you will get it.
These patients, though not immediate beneficiaries of the drugs received from the drone center, laud the intervention.
My machine will have been pregnant. Na machine no na first ya bakwani enum se de drone eba. E ba sa ye bochanku ya kohwe. Na namba doctor mu am dem baba ya no. Ena ma behu se machine de drone ba. Drone de ba ne se ya bia na drone bi wo ha na asa. Na ye se omu hia bi di ehwe ye. Te ba sa na omu timi de machine no de drone ba. E ma ye nya drone de hwe ni pa na ma nya hoden. Ti me pepa se machine na ba e boa ye santina na dro. Omu aye na dan nyina.
The drone delivery center, located at Mpanye in the Ashanti Mampong municipality, has made over 1,000 deliveries of blood components and other medical essentials to health facilities across the Ashanti region. The center comprises a warehouse where drugs and blood are stored and packaged, the monitoring and control rooms, and the drone operating center. Obed Bwachi Frimpong, a flight operator at the Zipline Mpanya Center, says the facility will rope in health facilities onto its system soon.
We are targeting currently having about 500 facilities when we are fully operational, and by our estimations, by the time we hit there, we should be having roughly 150 flights a day, and everything shows that we are heading towards that direction. From October, for Impenya alone, we've made close to 1,000 deliveries already, and that's a huge one because it's been roughly 3 months. For the time that we've been here, we've actually been able to deliver on certain products that sometimes they didn't have at a point in time, and it's been interesting how pleased they are with our services and how they find that our deliveries are very timely with certain drugs that they need, especially with emergencies, that whenever they call us, we are delivering on time
This is the drone operation center, and each of the drones here, which are referred to as ZIP, have a specific code on them. A lot of checks are being done before even the drone is sent to any health facility that put in a request for blood or medical essentials. From there, the operators here do those checks and are brought finally here to the launcher. This is where the drone is put and is launched, given the location, and there it will fly to wherever the location, the actual location where the essentials will be delivered. After the delivery, we have the recovery points where the drone will be recovered when it's done supplying essentials. So it has just recovered, and this solely depends on the wind direction. And this is a final point where the batteries and the other parts are taken off and then put back at the stands. Reporting from the Mpanye Zipline Center, I am Hafiz Tijani for Citi News.